Hello everyone. It is now 3 weeks after my surgery. I didn't have a total thyroidectomy done. I only took out half, which I believe is a hemithyroidectomy, something like that. I made that decision like 30 minutes before surgery. My surgeon came in from the VA. He came in and he said, I think we should probably look into doing just half of my thyroid, because he noticed that I was just thinking of only doing half originally, and then I changed my mind to doing whole. And I was kind of hesitant, didn't know, had to think really quickly before surgery. He said, I'll come back and then you let me know your decision. So I talked it over with my dad. I truly felt more comfortable only taking out half, only because I will have half still there, and it will help. I might not have to be on medication later on for my thyroid hormones. So I felt more comfortable with that, knowing that I'll still have half to compensate for the one that's gone. And he said that it might not be a malignant nodule. So we went ahead and did it. He told me also that if it is malignant, turns out to be malignant, then I can go back in within the 7 days to take the other half out, or I can wait 2 months and take it out after 2 months after I've healed. So went and took half out. Right after surgery, they did keep me overnight because my blood pressure was a little low and my oxygen level was low. It was like in the 80s. When I did wake up, I felt like there was a heavy thing on my chest. So they had me do this breathing thing on the spirometer, or whatever that thing is called. And I couldn't even get the ball up going. So after a while I did, though. I stayed overnight, and I was able to go home the next day, so I was better. My oxygen level was better. My blood pressure was good. And I was still able to continue taking my blood pressure meds. I was able to talk after, but not like too loudly or not too much. It was very tiring to talk, which it still is a little bit today, but I can talk longer than I did before. It just feels like how you've been yelling all night long and then you gotta talk the next day. And the day that after surgery, the doctor at the VA did order me no restrictions on my food, which I didn't quite understand. I was wondering why. It was they didn't give me any restrictions because I couldn't swallow. Not regular food. I could eat soup, soft food, because of the anesthesia. I guess they put that thing down our throat, and I could not swallow. So I was a little annoyed. Like, they didn't even ask me if I could eat solid food? So how do they know how I feel? Anyways, I was able to talk to my nurse, and I said, I can't eat that unless you want more work for yourself, because I'll be choking then. You can try to give me the solid food, but I won't eat it because I don't want to cause you more work. And I don't want to choke. So they gave me another tray, but it still had chicken and vegetables that were still hard, and that at least had mashed potatoes, so I was able to eat that. Then my dad, luckily I had my dad there. He went and got me some soup from the Thai place that was close by the VA. But after that, I did go home that next day. Everything was fine. No pain really for me. I didn't really have to take meds. They gave me some hardcore meds, but I didn't take it at all because I don't like taking them. I did take Tylenol just in case I felt anything. But after that first day, I don't think I took anything. And I was off for 2 weeks. And I think I needed that 2 weeks. I was also on my, the monthly thing for women, and it was really heavy. So that was making my hemoglobin go down, and my blood pressure was really low. I don't know if it was because I was off of work. But work is very stressful, being a lab director. So my blood pressure was really low, like 99/65. So my doctor told me to stop taking one of my blood pressure meds. So I'm only on once per day instead of twice. I was also on a diuretic to help with the blood pressure, and my potassium was low. So I was on potassium pills. My primary care doctor also took me off of my diuretic. My blood pressure has been good. Sometimes it's a little low still, but my heart rate is still up, so I'm still taking my atenolol. Sometimes it's at 99 or 100. So that was a tasking as well. I was really tired. Like the first week and a half, I was able to feel a little better towards the end of the 2 weeks. Still couldn't talk a lot, but I needed the 2 weeks because I was very, very tired. It was probably from my low hemoglobin and probably the low blood pressure. Other than that, like walking, doing things, I did get exhausted pretty easily. Probably again, it's the monthly thing and low blood pressure, but I'm starting to feel better now. Although I did have a little, worry because my throat was a little bit swollen. So I don't know if you guys can see it here. I still feel like it's a little pushed up against my esophagus. Sometimes when I lay down at night, I still have to prop myself up on pillows. And I just feel like I'm choking. So I did call the doctor. They said that it was fine. Probably because there's still a little swelling on the incision area. So now I'm just praying that the other side is cancer free, and I don't have to go through the surgery again, because I really don't want to, and I don't want to take all of my thyroid out. I was really dreading that, because the thyroid helps regulate a lot of things: your heart rate, your mood, weight, just your mental stability, and a lot of things that some we don't even know of. So I'm thankful that I have half the thyroid in, and I am happy with my decision. So let me know if any of you have experienced the same, or you're going through the same thing. My doctor did say my nodule was 3.3 centimeters big, and it was kind of difficult to get out. I'm like, ooh. He said something about a nerve too, so I don't know. Maybe that's why I feel like a little like there's a lump in my throat, but I don't know. But other than that, I'm healing pretty well. I still have a little hard time talking, as you can tell, probably because I was talking a lot yesterday. And yeah, let me know if you guys are going through the same thing. Just put a comment in the box. You know, the new studies now, if it's only on one side, that's big. The new studies show that it's better to take out the just one half instead of the whole thing. That was the old way of doing things. And if you, you know, they said it gave a better quality of life. At least you kept half in, because they were saying something about taking out the whole thing. It kind of gives you a lower quality of life as those compared to with breast cancer or other cancers. So I was glad to keep half. But yes, I wish you guys luck if you guys are doing the same thing. And hopefully this helped in making your decision on your journey. All right. Thank you, everyone. Bye. Hey, so I forgot to tell you guys what my results were on my nodule that they took out. The doctor found it to be, or the pathologist found it to be papillary thyroid cancer carcinoma. So that side was taken out, and I'm praying that I am now cancer free. Thank you. I'll continue on.